Hi, welcome back to the channel. This is Jen, your Medicare and retirement guide, and today we're going to be going over the internet's most searched questions when it comes between SSDI versus SSI and the Medicare eligibility and benefits rules for both of those statuses. And as always, if you find this information useful, consider sharing it, like and subscribe to the channel. Comment down below on what other topics you would like me to go over in terms of our healthcare industry or healthcare insurance in general. So the first question I have here is, what's the difference between SSI and SSDI when it comes to qualifying for Medicare benefits? So SSDI is Social Security Disability Insurance. When you have that program, after 24 months, on the 25th month, you are entitled to getting Medicare. You can go to Social Security, they will pull up your record, see that you have been on SSDI for 24 months, and there you are absolutely entitled to getting your Medicare. SSI, which is Supplemental Security Income. Those recipients do not qualify for Medicare. Instead, they qualify for Medicaid for the state of California, for myself, Medi-Cal, and they can become eligible later for Medicare due to age or certain special rules that they could qualify for as long as those criteria is met by the recipient or the recipient's family. Here, the second question is, if I have SSI, do I automatically get Medicare or do I stay on Medicaid? So here, if you are SSI only, you will only qualify for Medicaid in general. You do not qualify for Medicare unless you are turning 65 and you are transitioning into Medicare while keeping the Medicaid as the secondary. Now, a certain circumstance of how to transition from SSI to SSDI would be if a parent, if you're an adult with a disability and you've been on SSI your whole life, if your parent turns 65 and they are of retirement age, they can go ahead and bring you in as a secondary for their retirement benefits. So essentially, you can go ahead and switch from SSI to SSDI the moment a parent becomes eligible for retirement. Now, certain rules may apply. We are in 2025. I do not know if that rule is going to stand. So always double check with Social Security, see what are the different special terms and conditions that you can qualify for when you are an SSI recipient, and see what you can qualify or do to go ahead and switch over into SSDI. Now, the next question I have here is, can someone on SSI qualify for extra help with Medicare Part D? Yes. In fact, if you have SSI, you can qualify for something that's called extra help or low income subsidy for medication or Medicare Part D plans. So there are 3 different levels of low income subsidy. There's level 1, which the payment is around $7 to $12. This is 2025 pricing. It can change in the future. Level 2 right now is ranging between $1.60 to $5. And then level 3, it's 100% covered at $0. So if you are an SSI recipient, you may qualify for low income subsidy to help pay for those prescription drug medications. Next question I have here is, if I switch from SSI to SSDI, how will it affect my Medicare or Medicaid coverage? Now remember, as I said before, SSDI after 24 months qualifies you into Medicare. You may continue in the meantime receiving your Medicaid. That is not going to affect your Medicaid at all. And then once your Medicare starts, you will be known as a Medi-Medi, a dual insurance earner. So you will have both Medicaid and Medicare, and you qualify for a whole slew of benefits at that point once you have both plans. Remember, when you are Medi-Medi, the Medicaid applies to your state only. If you go to a different state, the resident state that you are a part of does not necessarily inquire or need to pay for any medical services done outside of your current resident state. So just keep that in mind. If you are going from state to state, your Medicaid will most likely not follow. Terms and conditions apply to every single state. So make sure you just know the rules and benefits of your state. The next question I have on here is, are there specific Medicare plans or savings programs available only to those on SSI? Yes. Just like what we covered earlier, you can qualify for dual eligible special needs plans, or DSNPs. That happens when you have both Medicare and Medicaid. And if you're someone who's already receiving SSI, you most likely will be a Medicare, Medicaid recipient as well when you qualify for Medicare. And those individuals will qualify for things like low-income subsidy and having their prescriptions paid for, having almost all of their benefits for their healthcare services needs paid for entirely. The last question I have on here is, what's the difference in timeline? How soon after getting SSDI or SSI will I qualify for Medicare? So always remember, after 24 months on being on SSDI, you automatically qualify for Medicare. However, if you still have SSI, please put in your application for Medi-Cal or Medicaid. You qualify for those benefits, and you qualify for different state programs when you have SSI. But make sure you contact your Department of Public and Social Services to see what other public programs with your state you are able to qualify for. Remember, after 65, you can go ahead and have SSI, you can have your retirement check, you can have your Medicare, you can have your Medicaid. That is all going to be sorted out the moment you go to the Social Security office. So make sure you just ask these questions. If you found this information useful, please feel free to share this video, like and subscribe. Comment down below as to what further questions or which part of healthcare you would like me to cover and answer the most searched questions. And I'll be sure to put out that content and information in the future. My information, if you would like me to go over your plan options, description down below, click that link. I would be more than happy to help you and see what plans are available in your area. I hope you have yourself an excellent day, and I'll see you in the next one. Bye-bye.